I want to tell you a story about an observation that I made about my own health because this is going to be something that a lot of other people struggle with, but it's something you don't notice. Like on a just general basis, you don't notice. I've seen this before a couple times in my own health, but for the most part, it's a very subtle thing and it's something that it just doesn't stand out. So last week, I noticed around midweek that I was getting a little bit more irritable. I was getting a little bit more anxiety. My temper level just wasn't great, and I could tell you that if my mom were still around, she would tell you that patience was never my best virtue. So I've gotten better at this, but it's something I struggle with, and it's something I've worked very hard on. And last week it was just not there at all. Like I had zero patience, and I didn't want to deal with anything. Just wanted everything to be done right now and be done right, and go from there. And I think a lot of people are like that, but still, it was just different than normal, and I had no explanation for why. And then a couple days later, it was probably Friday, that I started getting a couple little spots of poison ivy. And I was like, got it. So I figured out why all this was coming about. Now, Saturday I woke up and it was awful. Like I did something stupid. I weed eated I just had shorts on. So I have poison ivy all over my lower leg and everything like that. So this recorded in September. So give you a little context, but it is awful. It's really, really, really awful. It has been 100% completely miserable. Not just to the point where it itches, but to where my leg is swollen enough that it hurts to be because it's swollen. It hurts to move because it's so swollen. Things like that. So what I noticed about my health though is I had symptoms 2 days before. Why did I have those symptoms 2 days before? It's because my inflammation level was starting to go up. And as that inflammation level started to go up, I was more irritable. I was less patient. I had more anxiety. I was just wiped out, fatigued, different things like this. And inflammation is something we don't notice on a normal daily basis, right? Inflammation is something that is present in all diseases, and it's very, very common in all chronic diseases. So there's diseases that are there for long periods of time, whether that's autoimmunity or allergies or any kind of arthritis or different things like that. Inflammation is an elemental part of that, right? It's a foundational part of all disease. You have inflammation with it. Now, I could tell this difference in my inflammation level, but many of us are acclimated to where we're at on an inflammation level. And I'll speak of this one from personal experience as well. When I had autoimmunity really bad, when my thyroid was going completely crazy, my inflammation levels were through the roof. And again, I didn't notice it on the way up there. But as my levels started coming down and as I started getting healthier and healthier, I knew my inflammation levels were coming down. I'm like, man, I can't believe that I didn't notice that was going on. I can't believe that I didn't notice that was a part of it. And every once in a while, I'll get exposed to a food that I'm intolerant to. That causes inflammation, and that's where a lot of this is coming from. Our diet is a huge, huge proponent of what we're using to cause this inflammation. Eating the grains and different things that are inflammatory in our systems. It is having a huge, huge impact on us. Sugar is one of the worst ones, and sugar is in everything. So the more we can work on the diet, the better off you're going to be. But the diet is not the only one. Any kind of allergies. We've had a ton of smoke in the air. We've had a ton of allergens this summer. There's a lot of dust over the last couple years. All of that stuff, whether it's sinus allergies or skin allergies in this case, or food intolerances, all of that drives a ton of inflammation. Again, those aren't the only things though. The things that we do on a daily basis. Are you taking care of your body as far as sleeping? If you're not sleeping as much as you should, you're going to have more inflammation. If you're not hydrated the way you should, you're going to have more inflammation. If you're not eating the way you should, like I said, you're going to have some of that. But the foundational things that we know we should do for our health are always going to help us minimize that inflammation level. They're going to help us move forward. But are you in a state that you don't notice that you're inflamed? And that's where too many people are. What would be an example of this? If you're gaining weight and you still feel okay even though you're gaining weight, you're probably inflamed. If you're having trouble with blood pressure, you're probably inflamed. If you're having trouble with Cholesterol levels, you're probably inflamed. If your gut is bloating, you're probably inflamed. If you have diarrhea or constipation, you're probably inflamed. There are tons and tons of symptoms. Memory issues, brain fog, sleep disorders. Any of those things are inflammation. They're related to inflammation. It might not be inflammation that's causing everything, but they are related to inflammation. So as we can start to bring our inflammation levels down, what is going to go down with that? You probably know the number of people with depression and anxiety have gone through the roof over the last 3 years. The events of the last 3 years have been especially damaging to our mental health. Now, like I said, I had a lot of anxiety last week when this started coming about. How many people would be better if they just got their inflammation levels down? I was just reading a research article yesterday. It's sitting right over here. About how much inflammation is correlated with depression as well. And that's not one that you actually think it goes with. It's you think depression is, you just don't have the chemical balance that you need to drive the machinery that you have. But it's very, very closely related to inflammation, and inflammation can cause depression. Depression can cause inflammation. So they go back and forth with each other. And that's the thing that hit me, is how many people are having issues with their anxiety or their depression or their cholesterol or their blood pressure or their weight gain or their sleep issues or brain fog or memory issues. And it's just because their inflammation has gotten so high, and they didn't have the outward signs that I got. Like I said, I've got just a leg full of poison ivy that shows me that I'm inflamed. But if I wouldn't have had that, I would have never known. I would have never known that it was just because my inflammation levels were higher. There's no outward signs of it. Can you do some testing? Yeah, the testing's not overly specific either. It just says, hey, you have inflammation. It doesn't say where is your inflammation or what your inflammation is causing. Or, for that matter, most of them don't even tell you what type of inflammation you have. So think about this as you go forward. Are you getting the sleep you need? Are you getting the water you need? Are you eating the foods that are good for you? Are you getting exercise? There are a lot of factors that go into this, but the things that are going to be the best are the ones that you can maintain, and those foundational areas of health are going to be the best. Oxygenation is going to be big, so meditation, like I said, getting out, moving around, exercise, all of those things are going to help you oxygenate. And as you oxygenate, you improve your energy production mechanisms. Those energy production mechanisms are ultimately what produce the inflammation as well. So as you can get more efficient in your energy production, you also see less inflammation being created. So I hope that this helps you. If you have any questions on it, obviously, comment below. I mean, that's something that I'd be happy to walk you through. But I hope that this helps people, because, like I said, it's something that if I didn't have the outward rash from the poison ivy, I wouldn't have known what was causing this. And I think a lot of people are in the same boat. They're having health issues. They don't know what's causing it. But if we could correlate some of those different things, it would be just a massive transformational moment for so many people's health. And that's ultimately what I want to see. I want to see you healthy. So if this helped you, like, subscribe, do something that's going to help me understand that this helped you, because like I said, I'm trying to figure out what type of information to share, but I thought that this was going to be something that was important, something that we don't always see, we don't always make the correlation, but it's something that I've seen multiple times in my life, and I hope that I don't see it in this way again. But it is what it is. It helped me learn, and that's the big thing. So I love you. I appreciate you. I hope you have a great week, and I'll talk to you soon.